accusing the U.S. of pushing false information about the coronavirus origins. NBC News correspondent Janice Mackey-Frayer has the latest from Beijing.
Allison, the back and forth of accusations and conspiracy theories about accusations continues here as China accuses the U.S. of a smear campaign in suggesting that the virus is linked to a lab in Wuhan. They say the U.S. is merely trying to ensure that President Trump gets reelected. Officials here deny that there is any evidence linking the virus to a lab in Wuhan. This contradicts the claims by Secretary of State Mike Pompeo, who says there is enormous evidence. Editorials here are attacking him. They're calling him a liar. They're calling him names that are less diplomatic. They're even attacking his religious values. China was already in the midst of a global PR campaign to deflect criticism over its handling of the virus by sending masks and equipment to several countries and even floating its own theories about the origins of the virus, linking it to the U.S. military. Secretary of State Pompeo has not backed down from his claim that the virus came from a lab in Wuhan, despite intelligence reportedly shared by the Five Eyes network of the UK, the US, Canada, New Zealand, and Australia that contradicts the claims by the Trump administration that the virus is linked to the lab in Wuhan. China today declared the entire country at low virus risk for the first time since the outbreak. New cases are near zero. There have been no new deaths for nearly 3 weeks. And even the trade data that was released today wasn't as brutal as expected. Officials here say they're open to working with the World Health Organization on virus tracing, but that they're not going to get involved in any investigation that starts with China being guilty. The back and forth of accusations is putting a strain on U.S.-China relations like never before. There is still a lot that we don't know about the virus, how it spread and how it became a pandemic. What is clear is that China is working very hard to deflect blame at a time when calls for investigations, inquiries, and compensation are growing even louder. Allison?
Nearly 40,000 Texas inmates are under strict lockdown restrictions after COVID-19 cases spread in prisons there. They are not allowed to leave their cells for meals or walks outside, and they can't make phone calls. NBC News correspondent Morgan Chesky joins us now. And Morgan, we know visitation also stopped in mid-March. This is a new level of isolation for prisoners. You've been reporting that prison chaplains are trying to help ease that isolation. What are they doing?
Yeah, Allison, it's certainly kind of an unprecedented situation for these inmates because lockdowns only are held for short periods of time, an hour or two, maybe a day. But with COVID-19 spreading throughout these prison populations, as soon as it pops up in one of these prison units, a 2-week lockdown immediately goes into place, and that is extended if and when a new case of COVID-19 pops up. So, as you mentioned, no one's leaving the cell. Food is being brought to them. They can't walk outside, and they can't make those phone calls, which is how many of them communicate with loved ones and just check in, if nothing else, with those on the outside. So in response, I had a chance to speak with the head chaplain for the Texas Department of Criminal Justice, and he and his team came up with the idea. It's simple, really, but it requires a lot of manpower of handing out notes to inmates. They write down a loved one's name, their phone number, and any sort of message that they're trying to pass along. In turn, those chaplains categorize these notes by prison unit and divide them up, and then they just start making phone calls. Allison, I had the head chaplain tell me he's probably made several hundred calls since they've started this program of sorts using staff from all over the Criminal Justice Department. They've made about 32,000 phone calls sharing all sorts of information, good and bad, with people who are on the outside wondering how their loved ones are doing on the inside and vice versa. Allison?
What an incredibly compassionate thing to do, Morgan. That is just amazing. I know you were in Huntsville, Texas yesterday, reporting on an outbreak there. How widespread is the coronavirus in the Texas prison system, and how are officials handling testing and treatment?
Well, they certainly have significant obstacles ahead of them because we've seen firsthand how prisons are acting as hotspots for the coronavirus. Right now, the Texas prison system consists of about 140,000 inmates that are spread out over more than 100 units across the state. The officials are saying that a third of all prison units, roughly give or take, are currently in that lockdown mode because of the presence of COVID-19. And we know that one of the issues going forward is just trying to contain it within such a controlled environment where no one can get in and no one can get out, which you would think would make it easy. But in turn, it just allows the virus to move among the prison population. On their part, the officials say that they've tested right at about 1,700 inmates who presented symptoms. And then of the number that they tested, 70% came back positive. Now, that's only about 1% of their entire prison population. So as soon as you are tested, as soon as you have tested positive, they take you to the infirmary, you're kept in medical isolation, and then as soon as you're able to, you're taken back to your cell and you're kept there essentially until you're no longer well, you're kept there anyway, Allison, but that is where you stay, and they check on you medically to make sure that, of course, should you need hospitalization, they'll absolutely receive that. But when critics called them out for not testing in larger quantities, they said that their response to the virus wouldn't necessarily change whether they did mass testing, as they're doing in Ohio, or if they're testing just those with symptoms, as they're doing right now. Allison?
Morgan, it's an incredibly challenging situation trying to curb that virus in prisons. Thank you so much for your report.